Medicare Explained. What you actually need to know. Medicare Explained. What you actually need to know. Target audience. Medicare beneficiaries, near retirees, and family caregivers. Estimated runtime, 9 to 11 minutes. Calm, clear, reassuring. Never salesy, never alarmist. Visual. Host at a desk with a simple Medicare Basics graphic behind them. Host. Medicare Open Enrollment. Medicare Advantage. Part A, B, C, D. If just hearing those terms makes your head spin, you are not alone. And today we're going to make it simple. No sales pitch, no pushing you toward any specific plan. Just a clear, honest breakdown of how Medicare actually works and the dates you need to circle on your calendar. Host VO. Welcome back. If you're new here, this channel breaks down health and money topics for older adults in plain English. Let's get into it. Section 1. The 4 parts of Medicare. Parts A, B, C, D as 4 labeled boxes. Host. Let's start with the basics. Medicare has 4 parts and they cover different things. Part A is hospital insurance. It covers inpatient hospital stays, skilled nursing care, and hospice. Most people don't pay a monthly premium for Part A if they've paid Medicare taxes for at least 10 years. Part B is medical insurance. This covers doctor visits, outpatient care, preventive services, and durable medical equipment. Unlike Part A, this one does have a monthly premium, and it comes directly out of your Social Security check for most people. Part C, also called Medicare Advantage, is an alternative way to get your Medicare benefits through a private insurance company instead of directly through the government. These plans often bundle in extra benefits like dental, vision, or hearing. Part D is prescription drug coverage, also run through private insurers. Original Medicare is Parts A and B together. Medicare Advantage is Part C, which usually includes Part D built in. On-screen text. Part A equals hospital. Part B equals medical. Part C equals Medicare Advantage. Part D equals drugs. Section 2. What it actually costs in 2026. Simple cost breakdown graphic. Host. Let's talk real numbers, because this is where people get caught off guard. For 2026, the standard Part B monthly premium is $202.90, though it can be higher depending on your income. There's also an annual Part B deductible, which is $283 this year. Here's some genuinely good news. Starting this year, there's a cap on how much you'll pay out of pocket for prescription drugs under Part D, $2,100 per year. Once you hit that number, your covered drug costs for the rest of the year are covered. Now, Original Medicare alone doesn't cover everything. It typically doesn't include routine dental, vision, or hearing care. That's part of why people look into Medicare Advantage or a Medicare supplement policy, which we'll touch on next. 2026. Part B premium, $202.90 MO. Deductible, $283. Part D out-of-pocket cap, $2,100. Section 3. Original Medicare versus Medicare Advantage. Visual, simple side-by-side comparison graphic. Host. This is probably the single most common question. Should you stick with Original Medicare or go with a Medicare Advantage plan? With Original Medicare, you can generally see any doctor or hospital in the country that accepts Medicare. Many people pair it with a separate Medicare supplement, or Medigap, policy to help cover the gaps, deductibles, co-pays, co-insurance. With Medicare Advantage, you're usually working within a network of doctors, similar to an HMO or PPO. Many plans include extra benefits like dental, vision, hearing, or even gym memberships, but you'll want to check that your specific doctors and pharmacies are in-network before switching. There's no single best answer here. It really depends on your health needs, your budget, and which doctors you want to keep seeing. This is exactly the kind of decision worth a conversation with a licensed Medicare counselor, which is free through your local state health insurance assistance program, or SHIP. Original Medicare equal flexibility. Medicare Advantage equal extra benefits, network rules. Section 4. The enrollment windows you need to know. Visual calendar graphic highlighting key date ranges. Host. Now here's the part that trips people up the most. The enrollment periods. There are a few different windows, and they each do different things. The fall annual enrollment period runs every year from October 15th to December 7th. This is the big one. During this window, you can switch between Original Medicare and Medicare Advantage, change your Medicare Advantage plan, or change your Part D drug plan. Any changes you make take effect January 1st of the following year. The Medicare Advantage open enrollment period runs January 1st through March 31st. But this one only applies if you're already enrolled in a Medicare Advantage plan. During this window, you get one chance to switch to a different Medicare Advantage plan, or switch back to Original Medicare. And outside of those, there are special enrollment periods that open up if you have a qualifying life event, like moving to a new area or losing other coverage. One more thing worth knowing. Every September, your current plan is required to send you an annual notice of change letter. Read it. Plans can change their costs, covered providers, and drug lists every single year. Even if you don't touch a thing, your plan might. Fall AEP, OCT 15, DEC. 7. Changes effective. Jan 1. MA OEP, Jan 1 to Mar 31. MA members only. Section 5. How to avoid common mistakes. Host. A few honest tips before we wrap up. First, missing your enrollment window can mean waiting a full year to make a change, and in some cases, late enrollment penalties that stick with you permanently. Mark the dates. Second, be cautious of anyone pressuring you into a specific plan over the phone. Free, unbiased help is available through your local SHIP counselor. I'll put a link in the description. And third, if you enroll directly through Medicare's official website, you now have added protection in 2026 if the plan's network information turns out to be wrong. That's one more reason to go through official channels rather than a random third-party site. On-screen text. Get free, unbiased help. Your local SHIP program. Recap. Host. Let's recap. Medicare has 4 parts. A for hospital, B for medical, C for Medicare Advantage, D for drugs. The fall annual enrollment period runs October 15th through December 7th, and that's your main window to make changes for the following year. And when in doubt, free, unbiased help is always available. You don't have to figure this out alone, and you definitely don't have to take the first offer that lands in your mailbox. Host. If this helped clear things up, give it a thumbs up and subscribe. We cover a new health or money topic for older adults every week. Drop a comment if there's a Medicare topic you want explained next. Thanks for watching, and I'll see you in the next one. End screen, subscribe button, disclaimer. This video is for general educational purposes only and is not personalized insurance, medical, or financial advice. Medicare rules and costs can change. Always confirm current details at medicare.gov or with a licensed SHIP counselor before making enrollment decisions. Evergreen note: premium and deductible figures shown are 2026 numbers and will need a quick update each year, typically announced by CMS each fall. Medicare.gov.